I'm going to accept both patients. If you are a therapist that is in 2 professions and 2 practices, when you click accept, you will have the option of connecting the patient to the correct profile. So remember that if you are maybe working in 2 different practices as an OT, and say that you are a younger therapist and you maybe work with one practice in the morning and another practice in the afternoon, remember that when you add the patient to the practice profile, to click on the correct practice profile for that specific patient. If by any chance a profile and request comes through twice, you can easily click on the patient name and then decline the invite. Now that you have accepted the patient, you can now get started with adding patient information. I'm going to click on Carl Jones. You can see that I need to add the new assessment and get started with this patient. First, I'm going to click on the eye. This will then open up Carl Jones's information. I can see that his primary client's name is Erin and his primary therapist is myself. If I would like to add an additional client, I can click on the plus button, and this will allow me to add an additional client to this patient's profile. This might be another parent, a guardian, an au pair, a teacher, any other individual that might need to be added to this patient profile. What must be known is that when you add an additional client or parent and guardian to the patient profile, the invite will get sent to the primary client first. This ensures that we comply with POPI. So as I send this request, it will first go to Erin, the primary client, and then once Erin approves and accepts the additional client coming onto the profile, the invite will then get sent to the client, parent, or guardian. So this ensures that we are covering your back as a therapist. The same happens with adding a therapist to the patient profile. If I click on the plus button, I can enter an additional therapist's email address. I can choose whether the therapist should see all the notes or only future notes. And when I click the request will first go to Erin, the client, to accept another therapist joining the patient profile before the other therapist will be able to join the profile. What must be known is that by adding a therapist to this patient profile at this point on the patient profile, this therapist will share the same notes as you. So if you are working with a locum, or you maybe work in a practice where there are 2 therapists treating one patient, this is where you will add the additional therapist to the patient profile. If maybe there's a therapist that works down the road in the special needs school and you work in a private practice in the afternoons, you won't add their profile over here. That therapist will send an invite to the parents and the client will then create a new profile for Carl Jones. Make sure that a therapist that is treating the patient with you and alongside you, and you are happy to share the file with that therapist, you will add them here on this profile. If it is a therapist that is maybe in another profession or works in another practice and you don't necessarily want to share your file with this therapist, they will send the invite from their own practice to the client, and the client will then create a new profile for their child. And then those 2 notes and files will be separate. They won't be together. If you click on the pencil button, you will then be able to update the patient's name. So if for some reason the parent maybe entered the wrong name, you can update the patient name, the date of birth, and you can add the day that the patient comes for therapy. If the patient comes for therapy twice a week, you can add both those days for therapy. Now you can see that you can go to your next patient and you can update that patient's profile, and you can enter the days that they come to therapy as well. When I'm looking at my profile, I can see that tomorrow's patients, I'm seeing Samantha, and all my patients, I see Carl Jones. Obviously, as you add patients to this, your patient list will grow, and you'll easily see today's patients, tomorrow's patients, and all your other patients in your list in an alphabetical order.